Hello, and welcome to Surgery Squad's virtual laparoscopic cholecystectomy. I'm Dr. Susie, and I'll be guiding you through this procedure today. Your gallbladder is basically a place that stores bile generated by your liver. As your body digests fats, your gallbladder pushes bile into the common bile duct, down to your small intestine, to help digest them. Gallstones form when the bile hardens into small pieces that block the common bile duct. These stones can consist of calcium, blood, and cholesterol, and they can cause moderate to severe pain, along with nausea and/or vomiting. When this happens, it is called a gallbladder attack. Gallbladder removal is the best treatment for gallstones. There are two types: open gallbladder surgery and laparoscopic cholecystectomy. Open gallbladder surgery involves one large incision and removal of the gallbladder. It is performed when the laparoscopic method is not possible, or when complications or too much scarring from previous surgeries are found, or when the patient's blood won't clot well. This type of surgery causes more pain and longer recuperation time. A laparoscopic cholecystectomy, however, is the most common and often the best method to remove a gallbladder. It is where the gallbladder is removed through several small cuts in your abdomen. The surgery is safe, and folks who have it normally recover within 1 week. There are a number of benefits to having laparoscopic cholecystectomy. Among them, you'll be able to eat food without pain in most cases. It eliminates any discomfort in the stomach lining, and in some cases, it relieves your upset stomach. However, if you have your gallbladder removed, you might experience chronic diarrhea, indigestion, trouble digesting, severe liver problems, fatigue, and rare but intense abdominal pain. The patient waiting for us has been suffering from pretty severe gallstone pain, so it is imperative we get his gallbladder out. Let's scrub up and get going. Our patient is already under general anesthesia, thanks to our nurses and anesthesiologist. We're going to make 4 small incisions, 1 right below the belly button and 3 others right over the abdomen. First, we'll disinfect the area where we're going to make our first incision. Good! Now take your scalpel and make a small incision right below his belly button. Nice and clean. We've got to see where we're going, so we'll first inflate his abdomen with a little carbon dioxide to have some room to work. Just right. Now we'll use this laparoscopic camera to help us see where we're going. We'll watch our monitor as we go. Slow and steady. You're doing a great job. And there it is. I'll take care of the other incisions for our laparoscopic tools. Now that all of the trocars are in place, can you move the liver out of the way using the clamp so we can get to the gallbladder? Excellent work. We should have plenty of room to work now. Before making any incisions into the gallbladder, we'll need to clamp off the bile duct in 3 locations. Great. Now use the scissors to sever it. I'll hold the gallbladder in place while you work to cut it from the liver. We'll use an electrocautery device to minimize bleeding. Fantastic! Looks like you've done this before. One last thing. Let's take our clamp through the cut under the belly button and pull this guy out. Nice work! Our scope shows that everything's clean. We've removed the gas, so let's close him up and get him to a fast recovery. Our patient is now in recovery, and he'll probably be there for a few hours. We'll